My name is Dr. John Kani. I'm the pharmacist in charge of the Moi Teaching and Referral Hospital Anti-Coagulation Clinic, and I also oversee pharmacy services in the surgical department of the hospital. The Anti-Coagulation Clinic was started in December 2008. The clinic has grown tremendously over the last 10 years, from a crowded pharmacy office to the current clinic, which is based at the Chandaria Cancer and Chronic Disease Center. We have grown from the initial two pharmaceutical technologies that we had to the current staffing, where we have 4 clinical officers and 2 pharmaceutical technologists and a records clerk. We also have me as the in charge of the clinic, and then we also have clinicians who we have on call when we have difficult patients to just help us in managing complicated patients. We have over 3,200 ever enrolled patients, with over 2,100 active patients actively receiving care in the clinic. The anticoagulation clinic or the anticoagulation monitoring services are important in this hospital because we see a lot of patients who have indications of anticoagulation, and it's important to make sure that they are adequately anticoagulated and also prevent bleeding events, which is associated with most anticoagulants. So we have different conditions that are indications for anticoagulation. We have either patients with clots already, so deep venous thrombosis and PEs, or patients who have cardiovascular risk factors that put them at risk of developing clots. So patients with rheumatic heart disease, patients with atrial fibrillation, patients who have had valve replacements and such things. And the anticoagulation monitoring is important because in our setting we'll still use most of the patients are still on vitamin K antagonist, so warfarin, and which needs monitoring compared to the newer anticoagulants, which are still inaccessible to most of our patients because of cost. We have point of care INR machines. So patients basically come to the clinic, we do their vitals, so we do the blood pressure, we do a point of care INR, which usually takes like 3 minutes to get it. Then based on the INR, we adjust warfarin doses, weekly warfarin doses based on the INR, and their targets INR based on their conditions. A clinical pharmacist plays a key role in the anticoagulation clinic. So we basically are involved in adjusting warfarin doses based on the INR for the different patients that we have. So depending on how the INR is, there are protocols that we follow to either adjust the warfarin dose upwards or downwards to ensure again that the patients are adequately anticoagulated while preventing the bleeding risk of these anticoagulants. I also play a key role in helping to oversee the day-to-day running of the clinic, basically interacting with the clinicians, helping to solve the different problems that we have in the clinic, as well as I'm also involved in teaching for the students who come for their rotations. It's either interns, students on training, or master students who basically have rotational activities in the clinic. We have had various achievements in the clinic. So one of the key achievements is that we've had one of our pharmaceutical technologists who works in the clinic present at international conferences, FIB, and people are impressed at what a pharmaceutical technologist can do in clinical care, and in collaboration with Pharmacist, of course. And we have also set up a monthly anticoagulation teleconference, which we have experts in anticoagulation abroad, and it's online, so we invite as many people as possible. We basically discuss complicated patients in anticoagulation to just help us tailor-make their therapeutic plans. We have also celebrated our 10th year anniversary by participating in the World Thrombosis Day, which has just passed last week, and we saw a very big success in creating awareness about VTE in the hospital and even for our patients.